Slide Okay, good afternoon everybody. Shall we make a start? Yeah. Apology to those who are on Zoom and they are wondering what's happening. So we're about 10 minutes late, so we'll make sure we catch up on time. First of all, let me thank everybody, those coming in persons and those on Zoom. And also I would like to thank the University of Western Sydney for giving us this wonderful venue for us to gather together and hear from some eminent personality or persons in the field of Tai Chi, physiotherapy, traditional Chinese medicine, acupuncture, and related field of what we all love doing, okay? So most of us as audience, we are Tai Chi instructors, we are Tai Chi practitioners, we are Tai Chi enthusiasts. We are more from the hands-on, practicing. And also we have professors, if I may introduce them, and then later they will introduce themselves, and we'll be open for questions and discussions. So apology for the spelling. So there's Professor Blong Seng. He's very well renowned. He works at the University of Sydney. I met him also at the Royal North Shore Hospital. So he will tell you more about his work, and if it can relate to perhaps questions that we may have for him. Okay. So we also have Professor he's now retired from UTS, University of Technology Sydney, Professor Christopher Zalowski. Is that okay, my pronunciation? Yeah. So he will be there as well to respond to any questions that you may have. What he's been doing at UTS, he was the director of the New South Wales TCM Council. TCM stands for Traditional Chinese Medicine. He was also the visiting professor, and he's registered physiotherapists and Chinese medical practitioners. Okay, so that's quite a wide range of area. So you have Dr. Wen, Guidong Wen. Good, very good. So he's the president of the Chinese Medicine and Acupuncture Society of Society New South Wales. So most of us, or many of us, would have gone to see an acupuncture. So here you are, you have the president, and if you've got any questions about anything relevant to the acupuncture area, so he will be there. You also have Dr. Jennifer Liu, physiotherapist. Dr. Jennifer, very good. So very young, it's good to have new generation of professionals in our field. And you have James Cow, he's the vice chair of the TCA. He's a sixth generation traditional Yang Tai Chi. Also you have other multidisciplinary fields, health economics. I have an economics degree and master's. So here you've got a more specialized health economist. Dr. Moin Ahmed, would that be right? Good. And also we have another one from Westmead Hospital. So it's good to have those multidisciplinary. So what we're going to do is we'll start off with Dr. Emily Yang. She's a research, where's Dr. Emily Yang? She's a research fellow in healthy aging. What a good title, healthy aging. So we're all aging, we want to know what's good about, what are the ingredients, or what can help us to aging healthily. Yeah? So it's part of the University of Western Sydney. And then you have, where's Dr. John Zhao? There you go. Okay, John also is a very interesting person because he's got a doctor in physiotherapy from Macquarie University, also a graduate in traditional Chinese medicine. So his passion is about fusing, getting the best of both worlds, Eastern and Western area of medicine, would that be right to say? Yeah. And see how we can work together, okay? So there will be a agenda. Can we share this?
Okay.
Okay, for those in person, in terms of housekeeping, just outside you'll have the gents, the ladies, and also some water. Also for those on Zoom, if you have to ask questions, if preferably, just write it down. The reason being that sometimes the quality, the noise at the back could make it very difficult. Okay, so those on Zoom, if you can write down your questions. And after Emily has spoken for 20 minutes, then John will come in, and then we have the panel discussions. Let them talk for about maybe 20 minutes altogether, and then we are left with about half an hour. It's open to questions from anyone. Is that fair enough? And then we'll break for afternoon tea, and after that we might break into 2 sections, going downstairs for more space and practical Qi Gong, and also for Tai Chi for falls prevention, and a couple of more practical. And some of the more higher level academics and practitioners will hold some round table to talk about some relevant issues, contemporary issues that we face in terms of trying and have an integrated traditional Chinese with Tai Chi and so forth. Okay? So is there any questions before we make a start? All good? Yeah? Okay. Okay, if I have the pleasure to introduce first Emily Yang. She will talk about the global insights into Tai Chi, clinical trials, and health benefits. Please welcome her.
Everyone for joining during Saturday for this wonderful event with us here in this beautiful NICM Health Research Institute's building. So it's my pleasure to be here. You can't hear me?
Yeah. I put the mic a bit closer.
Oh, okay. Yeah, I can use this.
Maybe the other one.
Okay, I try to use this one. It's better? Okay, great. So, it's my pleasure here to share the global insights about research current clinical research studies and Tai Chi's health benefits. So, firstly, I'd like to approach the country. Wisconsin University and NICM Health Research Institute acknowledge that today's workshop is being held in the country of the Dara people, and acknowledge their ancestors who have been traditional owners of their land, country for tens and thousands of years. And Wisconsin University also wishes to acknowledge and pay all respects to the elder past, present, and emerging. So, as Sarah mentioned, I am a researcher, young researcher at the NICM Health Research Institute, Wisconsin University. I have the passion to do research and also through my teaching to share the beauty of Tai Chi to the community. I also teach Tai Chi here. In our ground floor, we have an integrative medicine clinical center. I offer Tai Chi class here. And so firstly, let's go back to the origin of Tai Chi, which my Tai Chi master always tell this story to me, and which helped raise the passion for me to about share the beauty of Tai Chi. So many of you maybe know Tai Chi was originated in China, back to the end of the Ming Dynasty, 17 centuries ago. And a martial artist called Chen Wanting, after retired from his army life as a general, he go back to his hometown, which is a small village in Henan province, China, which is very famous now called Chengjiagou. And he started thinking and had time to embed himself into Chinese culture and thinking and do some reflection of his whole life. And so he combines the Chinese martial arts and military martial arts and Brazilian meditative techniques, philosophy of yin and yang, and a theory of traditional Chinese medicine into this slowly peaceful movement, which is later called yin and yang. And to why he creates this? Because he wants to have a better late life, to help improve his physical and psychological health benefits. And then it passed on generation by generation as a family treasure in their family. And later, because of the health benefits, attract the attention of the healthcare professionals. Tai Chi could be a great option, as we mentioned, not for their family, but also for everyone, because of the health and mental health benefits, and it has almost no special facility requirements, and it has venue flexibility, minimum requirements of the space. So that's why during COVID shutdown, people practice Tai Chi at home and can do indoor and outdoor. And it's suitable for almost all age groups, from kids to adults to older adults, can be a lifelong friend. And there are a variety of styles and forms to be chosen, so it's very interesting. And it can be practiced as individually or in a group, so it has some like social interactions. And it can be easily tailored to suitable for personal conditions and preference and individualized. And yeah, as mentioned, it can be a lifelong learning journey, always have space for improvements, and always provides the joy of improvement. And it also has connection to Chinese culture and philosophy. So for those who are interested in Chinese culture, Tai Chi can open the door for you. So as mentioned, because of the health and psychological benefits, Tai Chi attracts healthcare teams' attention. So since my team and my colleagues in Beijing University Chinese Medicine, Western University, and Harvard University, we did a research to look at the literature in the current Tai Chi research in the literature. Before 2013, there were 507 clinical studies, and we found that the first Tai Chi study by clinical study were published in 1958, and the first randomized control trial, which is called the gold standard of evidence, were published in 1988. That's about cutting rehabilitation. And since 2000, the clinical studies about Tai Chi were increasing steadily, including like the gold standard randomized control trials. And we also look at what happens between after we first published that one, and what happens in the next 10 years. So we find the clinical studies are increasing steadily, and majority were focused on adults and older adults who were aged 60 years or older, and very few focused on young adults or children, so there's still some research gap there. And those studies were conducted in 31 countries, and including 105 conditions and diseases. Those were published in majority in China, and second is United States, and Australia, and some European countries and African countries. So from this table, you can see those research studies covered almost all the systems, which matches the common disease and conditions among the older adults. So you can see hypertension, COPD, diabetes, knee osteoarthritis, heart failure, depression, osteoarthritis, breast cancer, coronary heart disease, and insomnia. And 25% of them were looking at healthy participants and looking at for health prevention, health promotion, or for prevention, or look at just some biomechanical outcomes. Yang style is the most popular, and followed by Chen and Shen style. This is probably because of during the history, Yang style is most popular. And Tai Chi was mostly commonly developed in those clinical trials. Face-to-face is the most commonly studied method to delivering the Tai Chi program. And majority were 1 hour per session, 3 times per week for 12 weeks. And However, we find that adverse events were underreported, and I think the majority of you, even we say Tai Chi looks like safe. However, in clinical settings, we still should pay more attention about the adverse events and should be reported and let everyone know how safe it is. And most of the studies reported at least one outcome favors Tai Chi. So now let's look at some high quality research published in top medical journals. So this is the one published in New England Journal of Medicine, which is the top one medical journal in the world. And Tai Chi, this study is focused on Parkinson's disease, involved 195 patients. And the researcher finds that compared to resistance training and stretching, Tai Chi group appears like have better results to improve their balance and also improve their functional capacity and reduce falls. And next one, we look at Tai Chi compared to multimodal exercise for preventing falls. This study also published in another high-quality research in JAMA, Internal Medicine. This study involved 670 adults in those with high risk of falling, like 80 years or older. And they find that Tai Chi reduced fall by 58%, and compared to stretching exercise, and compared to other multimodal exercise intervention, reduced fall by 31%. And another study published in the Journal of Clinical Oncology, which is also a top medical journal, 90 patients with as a survivor of breast cancer. The researcher compared cognitive behavioral therapy, which is the gold standard for improved insomnia. And the researcher finds that compared to the CBT insomnia, Tai Chi group significantly and clinically meaningfully improved the sleep. Another study still focused on sleep quality in patients with lung cancer. This study is a straight-on randomized control trial, and the researcher included 226 patients with advanced lung cancer, and they follow up for 16 weeks and find that statistically significant benefits on the sleep quality were shown in the Tai Chi group. This is also another well-known in the healthcare team study. It's about Tai Chi for this is kind of rheumatic disease, and Tai Chi group significantly improved the outcomes better, especially reduce pain, improve flexibility than the normal exercise, physical exercise. Another study were focused on knee osteoarthritis. Compared to physical therapy, Tai Chi significantly improved their outcomes. And this study included also a large-scale randomized control trial, including 204 patients. And let's look at another one. This one is focused on mild cognitive impairment, and with 304 participants. And the researchers find that compared to standard like normal Tai Chi and stretching exercise, this specially developed Tai Chi program can improve their cognition and memory. And so there are so many.
Sorry to interrupt. There's some people that are on Zoom that are saying that the slides aren't moving. They're still on the target screen.
This slide started moving.
Yeah, the slides aren't moving for them.
Not moving.
Yeah.
Oh, sorry. Let me stop sharing and re-sharing. over 6 months reviews because there are so many single studies, but we want to pull them together to see because when we pull them, the sample size will be bigger and the results will be more accurate. And so we did an overview of 210 6-month reviews, and we find clinically important benefits were mostly consistently reported for the following diseases. As you can see, like Parkinson's disease for prevention, osteoarthritis, stroke rehabilitation, low back pain, hypertension, chronic heart failure, and stroke prevention. But here you can see the quality still has space to improve. And so all this research can make another important contribution about clinical guidelines. So this is the researcher Dr. Tam and her team find that Tai Chi has been mentioned and recommended in 50 English published clinical guidelines, and Tai Chi were recommended 38 times. And let's look at this table. So as you can see, United States has 22 and Australia has 6 clinical guidelines recommend Tai Chi. And the developer, for US, you can see is some like a national professional associations such as the US National Center for Injury Prevention and Control. This is part of the CDC, American Heart Association, American Stroke Association, American Diabetes Association, and WHO. And let's look at some the clinical trials published by Australia. So some of them were not recommended. They just mentioned Tai Chi, but these 3 studies were recommend Tai Chi as an option. So in summary, so research on Tai Chi's benefits is increasing globally, and with increased attention and application in healthcare system, especially for conditions like cardiovascular disease, mental health balance for prevention, chronic pain, and cancer recovery. And however, more high-quality scientific research is still needed to inform and update those health professional rehabilitation or chronic disease management programs in clinical guidelines. And as we can see, there are still some understudied populations and conditions such as young people and children and ethnically diverse communities and mental health conditions. So that's a brief sharing from me. Thanks everyone for your attention.
Okay. Very good. Thank you, Dr. Emily Yang. They already a big clap for you. They've joined me to thank you for this very informative research over the last 20, 30 years and where we stand now. So next, if you have questions for Emily, please do keep them, and you can come back to her very shortly. So next, let's hear from Dr. John Zhao. He will talk about the interlink between physiotherapy, Western and Eastern way of TCM and Tai Chi. Okay, so do please welcome John.
Okay, today what I'm going to talk about is a very big topic. Tai Chi, Qi Gong, TCM, you cover everything, right? But because of time limited, so I can't go very deep. So I want to just focus on a couple of key points. And before I start, I just introduce myself. My name is John Zhou. I'm a physiotherapist, acupuncture, and the secretary of TCA. And why I choose this topic? So I actually start practicing Qi Gong Tai Chi very early. So when I was in high school, and it took me probably like many years to open the what is it called, the small circulation, right? Small circulation on micro cosmic orbit, so kind of. And after that, and I got started for many years, so to try to open the Dazhou, the great one. So which leading me to study Chinese medicine, because I want to know the channel series, the knowledge. I want to know. This is my purpose, my main reason to study Chinese medicine. Once after the Chinese medicine, then I actually achieved the great one, Dazhou Tian. And afterwards, I just start to curious, what's the mechanism? What's the mechanism of Qi Gong, Tai Chi? So which leaded me to study physio. This is my story. So today I'm going to share my experience, more my personal experience through my journey. Because of the topic is very, I would say very huge. So I just stick in some key points to make the topic simple and easy. Make sure after this topic, then everyone can have a solid overview of Tai Chi, Qi Gong, TCA, physio, everything. Okay, so the question just only why and how. So first question is actually a very big question. So why Tai Chi is one of the best exercise for health? One. I can't say the best. And everyone has your own idea. So some people say, this is a great mind-body exercise, low impact, very gentle, safe, and suitable for everyone, right? But my point of view, I will draw the idea from the microphone working well. Okay, so maybe I just walk close to the microphone. Okay, so my point of view mainly draw from my background as a TCM and a physio. So I would say, in my opinion, Tai Chi is unique. That's the unique exercise. So which is a unique bridge blending the ancient martial arts with like modern science, and also blend the Western medicine with Eastern medicine. So it's very unique. So I don't want to go through all the points. Probably you definitely can see on the point. So my point of view is unique. Very simple, right? And not just the people think the like low impact kind of thing, because it's mix a lot of wisdom inside. And after that is another big question. Why do we need to practice Tai Chi? So from two aspects. First is public health. So Tai Chi is the good exercise, including active health management, physical fitness, to improve the integrated Chinese medicine principles, and also help mental health and promote the social interaction. Is that right? So that's for the general public. But on the other hand, especially, so today is a lot of health professionals. For us, Tai Chi is also very good exercise for us for the self-care. So for example, can maintain our physical capacity, and also Tai Chi is the foundation skill for the manual skills. For example, even whatever the Chinese medicine or physio. For example, for physio we do a lot of manual handling, right? We need to carry the patient, walk around. But Tai Chi is very good at techniques. Also, we use the whole body strength to do this, to achieve these skills. And also, Tai Chi can help us to prevent the disease and keep our mindfulness and the focus. So it's very good, right? Very unique exercise. And why exercise? Why is exercise medicine? So gradually go to deeper. Because it's more related to active health management. So nowadays, in the healthcare system, we usually combine passive treatment with active health management. So this is give us the holistic solution, the treatment plan for for the patient. So here, just quickly compare to the passive treatment. So normally, active management, for example, active management usually is, we use a lot of physical activities, exercise. Tai Chi is one of the good exercise for.
I need to switch because people online they can't see.
Okay, so this is the first. And the second, for passive, we usually use the medications, surgery, is that right? And the active is more like for using exercise, and lifestyle change. And also the passive treatment directly target on the symptoms to treat the condition. But active approach is usually use our body plasticity and regulate the self-regulation to maintain our health. It's a very different way. And so on the other hand, for example, for the passive active way, I would say we usually can improve our strength, balance, coordination, the overall fitness, right? This is more the body physical capacity, which you usually cannot just take medications or surgeries can help you to improve the strength. So this is what I want to emphasize is passive and active always need to combine together. Always need to combine together because active way is more for the prevention, more for the long-term health benefit and improve the quality of life. And passive way more for the acute, severe condition. You definitely need a passive treatment. So in here, that's why I say maybe we think medication surgery that's all the medical medicine. Don't forget, Tai Chi exercise also can be the medicine in lots of scenarios. Okay, and how Tai Chi related to TCM, TCM exercises. So what's the relationship between Tai Chi and Chinese medicine? So actually, traditional Chinese medicine exercises usually we call Gong Fa. It's like kind of Kung. That's TCM Kung. So it's a form of mind-body practice and combined Chinese medicine series. And it use the Chinese series, for example, the meridians, Qi and the blood and the internal organs series. And Tai Chi is the key component of Chinese medicine exercises. So it's very important. Along with Qi Gong, in the classics, Yellow Emperor in the classics called Daoyin. Now we changed the name to Qi Gong. So this is the two main components. Actually, Tai Chi and the Qi Gong is the foundation of TCM manual skills, including acupuncture, massage, bone settings. It's very important because this is the foundation of Chinese manual skills. For example, I'm not sure the Chinese style massage or cleaner, lots of techniques actually come from martial arts, which is Shaolin martial arts. So here I mentioned the muscle tendon changing classic. The I Ching Jing is the essential to do the Tai Chi. not the Tai Chi, do the massage. Still have some technical issue. But this is quite challenging for us because this time is the first time we have online and offline together. we don't really have this experience before, so sorry about the interruption. So almost finished this slide. One question. The question goes deeper and deeper. Okay, so for the people in the Zoom, probably we afterwards we send the PowerPoint into the Zoom. So not a real Tai Chi and Qi Gong. Because Tai Chi and the Qi Gong require our form, Qi, and the spirit, three elements, and regulate into one. So once you into this one, and you will achieve what we call Qi Gong state. If you can't achieve Qi Gong state, probably you can say this is just body movement, this is stretching, that's it. But not Qi Gong. Qi Gong is a specific state called Qi Gong state. How to achieve this Qi Gong state? First, we need to regulate our body. So by relaxing and balancing your body to feel the sensation of resistance. And sometimes people also can feel the magnetic force between your hands. And also we need to regulate our breath. Our abdominal breathing and all some natural deep breathing. So what we need to feel is open, closing feeling. Once you open and close, the feeling, you start to can feel the Qi flow. Sometimes we even can feel from our palms, hands. So this is a very important feeling for breathing. And then the last one is the mind. So we, through our imagination, visualization. So this is more physical, right? Visualization, imagination. So in Chinese called 内观, 内观. So visualizing to achieve the feeling, what type of feeling? Warmth, like numbness, tingling, even in the tip of fingers. Once these three elements harmonize, so we can achieve the balance and also grounded feeling of Qi state. So Qi Gong state. It is very important. If you can't really go into this state, probably follow these techniques. Relax your body, relax your mind. Most important thing, you need unify your body, your mind, and breathing together to achieve this state called Qi Gong state. Okay, very briefing the overview. So next question, also very important, very interesting question. What's the difference between Qi Gong and Tai Chi? Can anyone can help me to answer this question? They are same or different? Different.
One's a martial arts,
One's martial arts.
yeah. The other one concentrates on TCM.
Yes. Yes. Anyone want to share your idea? Okay. Okay, so I just want to ask you one question. So, Qi in Tai Chi and Qi in Qi Gong, the Qi, they are same or different? Different. Or same? Or different? Okay, answer this question. So, for this question, I discussed with James for many times. They are the same Qi or different Qi. Or even we can ask another, can ask Chris, is the Qi Gong, the Qi in Qi Gong and the acupuncture, the Qi in acupuncture, the same Qi or different Qi? That's a very good question. So probably here I just want to share my own personal understanding. So after discuss with many people, I noticed few Tai Chi practitioners can emit the external Qi. So I use very few Tai Chi instructors can do, and also few Qigong practitioners can develop internal strength. Very interesting, right? Even sometimes some people can do both. They practice both Qigong and they can do Qigong, they can do Tai Chi, but they say usually you can't use these two abilities at the same time. We can't do it at the same time. So whenever you want to send a Qi at the same time, have internal strength. A lot of people, I asked a lot of James. Yeah, so it's very interesting, why? Why is that? So actually, Luis already answered this question. Because one's martial arts, Tai Chi is martial arts, Qigong is Qigong. So before I answer this question, so let's look at the Qigong training system. This is all based on Chinese medicine. So based on Chinese medicine, our body separated two parts, external and internal. External is the meridian system. So we can use clean up to activate our cutaneous region and cholesterol. How to do it? Have you seen a lot of people practicing Qigong at the beginning of warm up the body? We need to tap our body to open the channels. This is the massage you can do. Then Yi Jing Jing, muscle tendon changing classic can help to. This is a very interesting Qigong target on 12 senior channels. Very different. So also the very famous 8 pieces of broadcast, quadrant. A lot of people practice. This is help us to open the 12 channels. Now another popular Qigong called 八部金刚功, 8 pieces of Vajra power. This is targeted on the 8 extraordinary vessels. So this is another Qigong. So you can see different Qigong, they target different part of the body, because sometimes you can argue they can do everything, right? But they always have some specific focus. So not any Qigong can do everything. So they Qingxi, 5 animal process and 6 healing songs, they can more focus on our internal organs. Then the last one is the 3 treasures, Qi Gong. So we usually practice what I mentioned before, just like 大周天、小周天, 靠内丹 meditation. This is more focused on Qi Gong. This is the different Qigong training system, right? What missing here? What missing here? What do you think? No, something missing here related to Tai Chi. Looks like we cover everything, right? Looks like we cover everything in Chinese medicine, but not Tai Chi. Not Tai Chi. This is why Tai Chi is different to Qigong. What is it? Interesting, right? We practice Qigong, cover the whole body, but missing the bone system. This is, let's look at some Tai Chi classics. So, Wang Zongyue, he mentioned, use the mind to guide the Qi, ensure it's calm and settled, so it can be gathered into the body. Interesting, right? Very interesting topic. Qigong will focus on the bone system. And also another Tai Chi master called Chen Tangxin. Chen Tangxin also states, mind unites with Yi. So Qi unites with power, and the Kang unites with bones. You can see lots of bones in Tai Chi classics. Interesting, right? But why? So I draw this chart is to help you to understand. So Qigong is more focus on part of our body, part of body. So use a physio term, the part practice. So focus on our body, human physiology, and internal body to integrate the forms, Qi, spirit. While Tai Chi is focused on our whole body, and it's also the external environment, because the nature of Tai Chi is martial arts. So Tai Chi is a combination of Qigong and martial arts. But also, although Tai Chi includes all the elements in Qigong, but also need to consider this is a type of martial arts. So that's why Tai Chi is more whole practice. So focus on the whole body, skeletal alignment, the coordination to generate whole body power, not just a local power. And also, Tai Chi is focused on the unity of internal body and the external environment. So Tai Chi is more functional training, more functional. So especially I want to highlight Yi. So in Chinese we call Yi, and I noticed in a lot of situations people translate Yi to intention. I think I think we need to Yi is not just intention. Yi is not just intention. Because in Chinese Yi also you could have another meaning called attention. So intention, attention, which means not only focus on yourself, you also need to pay attention to the environment. That's why Tai Chi is more functional. So we not just only myself, but also the internal, external, we need to in Qi Gong. That's why once we get the Qi into our bone system, it actually increase the pressure on our skeletal system and also promote our bone health. We should do that. Different idea. So maybe people agree or not. That's more my personal opinion. So next one is how to combine physio and the Chinese medicine exercise. So this is usually the body healing is from acute, subacute, chronic, and to return to life. So from internal body to external environment. The exercise we can consider part practice, we can use Qi Gong, core practice, we can use Tai Chi, forms. The function training, what's the function training? We can consider the push hands. Because push hands help us to do the section to the external environment. And here's an example for the Tai Chi, Qi Gong, if we use into balance for prevention. I don't want to state too much because James will give you some hands-on practice to let you to feel how Tai Chi can help the full prevention. So part practice we can use some Qi Gong, for example, like a single leg stance, this is the Qi Qi, a single leg stance, pretty simple. Then move on to the whole practice. So lots of Tai Chi forms can do. And the functional then we can do push hands. And this push hands is not for the fighting skill. It's try to build up your body to feel the sensation, to train your sensation system, to feel the external force, how to deal with this external compression. So this is the example. Because of time, hopefully these key points can cover most of the overview. If you're really interested in the details, probably you can join our following workshops. Thank you for your time.
Yes, again, thank you, John, for these interesting topics about integrating Tai Chi, Qi Gong, TCM, and also there are so many interesting questions. Okay, so it's a bit like starting to whet our appetite for more next time. Okay, whilst we are doing the chair for the panels to be seated, if you can join me to welcome Mr. Professor Chung Guan Li. He's the research director of this institute, and we are very, very grateful to him for supporting this workshop and for making this happen. Please do welcome Professor Li.
Thank you. Just a few words from firstly, I welcome you all, and especially Nan, she's co-organized by the patient and Nuclear Research Institute of University. For some of you know, the NICM, because NICM is originally set up by the federal government in 2007 and hosted by the We used to operate at the Catalan campus. Now we moved to the Western for the pandemic. And currently the whole building, so you can see that historical building, and all belong to the institute. 3 levels. There are many researchers here, and we conduct very, very research of country medicine and integrated medicine. We have probably a couple of things to mention. We have the integrated clinic, which is on the ground floor, which combines the GP, TCM practitioners, psychologists, and people in Wellbeing, and also all things together. So the integrated model for medicine. There's only one in Australia. I can't find any other clinic in Australia. So we have integrated clinic. We have the laboratory here, a state-of-the-art facility on the first floor. We house this is a second floor conference facilities here. We also have several important things. One is to have the TGA, TGA therapeutic administration, TGA credit laboratory testing all the company medicine products on the market. We actually have testing before release to the market. We test the stability, safety, and make sure it's meet the government regulation. We We also have recently completed the GMP manufacturing facility, which is on 101 floor. We can actually manufacture medicine on the 12 medication, small scale, which for companies who want to do the R&D work, or practitioners who want to develop their own products. So we have this sort of services to the whole community of the industry. We are very proud to be funded by the federal government, state government, also different industry partners. We do from the benchtop research to clinical trials, including Tai Chi, which my colleagues mentioned before. And as you can see, I very enjoyed the program so far, and I'm sure you can ask many of all Tai Chi expert in a way, instructors in a way. So that's very good. So we actually want to serve you. If you need anything from us, we're happy to help you. Use our facility, we plot it further, some collaboration, most welcome. So last word to say, thank you all, and have a great day.
Thank you.
Okay, thank you, Professor Lee. So what will happen next is the panel members will be seated here, open for questions, and I will give the microphone to anyone who's got any questions on the floor here. And for those on Zoom, if you found that it's a bit difficult, just write the questions down and we'll capture the questions here. Okay, please let's.
Please come over, gents.
Okay, so yeah. So get ready, panelists. Professor Johnson.
您请坐。好。
So it's working. Hello.
Yeah, so first thing we can invite Professor Prince to give an introduction of his work. Please have a seat. Welcome our distinguished guests.
Thank you, Emily. When I was first approached to come, I was asked to do like a little bit of a welcome speech, so I actually prepared a little bit of a PPT. So, yeah, just to introduce myself and talk a little bit about where I'm coming from. So, yeah, I've been an academic previously. I was at UTS 27 years, but I'm like similar to John and one of our other speakers here. I'm also a registered physio as well as a Chinese medicine practitioner as well. And while I'm a student of Tai Chi, I would not say I'm a master in any way. I have done karate for 44 years, and it's only in more recent years, the last 5 years, that I've become a lot more interested and taken up the practice of Tai Chi in a more serious and interested manner, I suppose. I was first introduced to Tai Chi in the 1980s, both in Australia, it was fairly new back then, but also on my first trip to China, and I'm going to show you a picture of me 40 years ago. And I'm currently a Tai Chi student with Sifu Alice Dong, who many of you know from Pele Wushu for the last 5 years, so she's been my teacher. So there you can see me in the red and blue jacket, black jumper. This is the Guangzhou College. It wasn't a university then. Standing at a stake, and as a foreign student over there on a short study tour, we all had to do a little bit of Tai Chi as well, but I didn't actually get any pictures of me in those days. But we were introduced to the concepts as well. So the interesting thing is I just returned from a study tour in China. I got back a week ago. It was with a fellow called Tarry Yip from the UK, and he took us on a 18-day Tai Chi study tour around China. We started in Beijing, went to Wudang, Shan, Wudang Mountain, down to Guizhou to look at the minority ethnic cultures of the Miao and the Dong down there, and we finished up in Shanghai. But along the way we got exposed to several masters of Tai Chi and also researchers as well. And we, as it says there, we attended School of Wushu. Here you can see the Shanghai University of Sports and the Wushu school there. And while we were there, we actually had some lectures on the benefits of, the health benefits of Tai Chi, which was fantastic. And that was a half-day morning we spent there with them. Just some lecture slides. One of the professors there that gave us a lecture, he looked at the use of Tai Chi with substance abusers, so his focus was on that area. And I just wanted to outline, you know, there's plenty of books around now on the benefits of Tai Chi for health. I'm actually reading the knee health at the moment because I do have a little bit of osteoarthritis there, and I found that Tai Chi has been great in maintaining my function and decreasing pain associated with it. And I also got to plug Peter Wayne's book as well. I've met Peter on several times, and that's a great, good summary for the general reader there. I did a quick PubMed search before I came 2 days ago, and you can see the number of publications in those key areas of Tai Chi: pain, balance, osteoarthritis, anxiety, insomnia, health. So it's just huge. The amount of evidence we have these days is quite overwhelming. I looked at a recent publication, 2016, not as updated as Emily's one there, but they found excellent evidence of benefit for Tai Chi for preventing falls, osteoarthritis, Parkinson's, PD, rehabilitation of COPD, and improving their cognitive function in older adults. They found good evidence for depression, cardiac stroke, dementia, and fair evidence for improving the quality of life of cancer patients, fibromyalgia, hypertension, osteoporosis. They said there was, this is what now, 8 years ago, there was no direct evidence for diabetes, rheumatoid arthritis, or chronic heart failure. So there are, you know, some areas that Tai Chi hasn't been shown. And again, I'm not going to read through these, but just some evaluation of the quality of the evidence, as Emily has said. You know, excellent versus good versus fair, and so on. And they did report that Tai Chi didn't worsen the condition, even though there were some minor events, adverse events noted. And this is just a fairly recent one again, looking at a bit broader, Qi Gong and Tai Chi. They showed that, or they concluded that there's beneficial effects in different age groups and health conditions, including decreasing blood lipid levels, reducing blood pressure, facilitating mobility, preventing falls, and improving overall quality of life. So Tai Chi has got a lot to offer. We're all here, we all believe that. But it does have cultural elements too, and we'll probably touch on those because that can be hard to engage the general population. So yeah, I'm looking forward to today and discussing with you all of the potential benefits of Tai Chi. Thank you. That's me on Wudang Mountain.
Nice outfit.
Thank you.
Thank you, Chris. I think let me first, since Chris just finished her interesting story, and let's ask a question start maybe from Chris.
Okay.
Yeah, it's very inspiring about your Tai Chi journey. As a researcher, and you are also a registered physiotherapist and Tai Chi practitioner. So what do you find are the key unique characteristics of Tai Chi and make it suitable for the mainstream healthcare?
Yeah, that's a good question. I think the first thing is there is a lot of abundant research evidence available out there, especially in some specific conditions or diseases. I think you need, and some of these have already been identified, we need minimal resources. It can be done in a fairly a small space with minimal use of additional tools such as weights or other machines. The third thing is it's social. I also go to Eastwood Tai Chi Community Group. Every day they're down there. They get anywhere between 30 to 50 people or 60 people. And they not only practice Tai Chi together, but they sit and have coffee afterwards as well. So it is a very social engaging, and the more people look at longevity these days, the more they know that social engagement is very important. A variety of different conditions can be treated as well, so you don't have to focus on one, so you can blend people in one class, and also there's few adverse events. So those are the key points I'd like to report back in.
Thank you, Chris. Now, I'd like to invite Dr. Byung-Sang. Oh, Professor also. Yeah, because since you are also in the medical area, so I think we start from medical area and then move to our Tai Chi professionals. Yeah. Yeah, just I think we want to hear about some of your introduction of your work before we start asking questions.
Actually, I put some PowerPoint for whatever reason it's not working, so I cannot present here. So actually, around 15 years ago, I was doing a master at the acupuncture at RMIT University, and then we went into acupuncture Chinese medicine. We already mentioned about Qi flow, Qi circulation, Qi stagnation, causing disease. So I thought, I like to prove. I want to know Qi is really existing or not. So if it's work, I will believe. If it's not work, maybe it's not science. So that I was trying to trying to get some research project. So I was lucky. I was here in University of Sydney. When I'm convinced them, I told them this is. Initially, I proposed them Qi Gong study. So they don't understand Qi Gong in medical school, medical practice. They don't have no idea. So I told them gentle mind-body exercise, which is 20 years ago. Meditation was very popular, and also exercise was popular. I told them this is combination of gentle exercise and meditation. And they thought, oh, interesting, let's try. So then I was doing for cancer study in the Northshore Hospital and Concord Hospital. We recruited 160 patients and randomized 2 groups. It took almost 3 years, and then we measure before after how the patient improved. Then we measure the fatigue and quality of life, like some sleep and nausea and vomiting and other symptoms. And then we also measure C8 protein and inflammation biomarker. After 10 weeks later, we did a 2-year study with a big randomized trial. Suddenly we found a patient who participated in 10 weeks in the Qi Gong study, improving all anxiety, depressions, the psychological symptoms, and a lot of fatigue and pain, and also sleep, all psychological symptoms, as well as quality of life related symptoms. And more importantly, they also reduced some inflammation, which we can measure with C8 and biomarker. And then they thought, oh, patients are very happy, we can improve all of the biomarkers. Then they want me to introduce part of that the hospital. So I was working at the RP and Concord, and later, oh, we have to introduce this one to the medical students, so he wanted me to stay and teach to the medical school. So it was developing a Tai Chi and Qi Gong program, later expand to acupuncture study and other lifestyle intervention. And then later I present all this study in America, and they said, oh, quite interesting. So especially one of the doctors says, oh, we have a lot of men who have been studying, and there's sexual dysfunctions, especially for prostate cancer patients. And then also my study showed them some sexual satisfaction of sexual functions improving. And then they wanted to come and try, so I went to Harvard Medical School, Public Cancer Institute, and then we went for study 3 years. Unfortunately, this study was not enough funding, but we cannot do big trial, but a lot of patients improve on the quality issues. Also, a lot of men, not only women, when they have some hormone therapy, they get a lot of heart flow symptoms, sleep issues. And then they said they're very happy, so now they also introduce as well. And General Britain, and then also when I was doing a lot about the study as well, then I presented a lot about the literature review as well as my study. And most of people think about medical doctors says, oh, if this is really good, it's a strong evidence, we like to lead our patients to Tai Chi Gong instructor in the community. So they asked me, who is a qualified Tai Chi Gong instructor? So this is another issue. That's why I was setting up the International Medical Tai Chi Gong Association in the US. And we'd like to see how we can provide some Tai Chi Gong qualification programs. So for the meantime, as you're in community, yes, in here, I'm sure there's many good Tai Chi Gong instructors and teachers and masters around. But sometimes when the doctors are going to recommend the Tai Chi Gong to the patients, they want to have someone who has the qualifications. So that other people in the community, Tai Chi Gong instructor, there's abundance of evidence why medical doctors are there not recommending Tai Chi Gong to their patients. Of course, they like to recommend. In healthcare system, there's no licensing, like acupuncture, there's a licensed acupuncturist. Or the physiotherapy, the government regulation, or the license. Medical doctor need the license. Tai Chi Gong instructors, this is really good. Unfortunately, we don't have a license yet. And then also, there's many schools around, and private school, or even some TCAA school, or sports university, they have programs, but they don't have qualification to even certification. You are qualified to provide medical Tai Chi Gong for medical conditions.
People can't history is like.
Yeah, I'm not sure. Okay. So then the issues was arise. So we found the attention medical Tai Chi Gong, the association, and made some standard guideline. And also we are educating. And then finally, after 7 years in US, there's a big university, which is for the School of Health Professions, that has program at physiotherapies and chiropractic and nursing and also orthopedic medicine. They want to have some elective for the medical students and other study students as well. And then also we are making some certification programs. So then, initially we try to do from outside in community. But because, as you know, nature of Tai Chi Gong, there's old chest style, old style, whatever different style. Some people, they say, we are the best. So sometimes they are not working together. So then there's a lot of barriers when you work in the community. So initially, we make qualification programs. We are recommending to the medical Tai Chi Gong instructors. And then at the same time, we are promoting to medical doctors and also go to medical conference, we are promoting. So this is what I'm doing, and also for the meantime, also I'm working at Ruan Hospital and medical school, and make a program for students as well as patients. I think this is my brief introduction, and we can discuss more later, whatever other questions that you
Thank you. Given your rich research and clinical work about using Tai Chi and Qi Gong as a integrative oncology treatments in rehabilitation for cancer patients, what are the benefits of Tai Chi for cancer patients, and what do you see the opportunity of Tai Chi's role in healthcare system for cancer patients?
Yes. Very long question.
2 questions.
Okay. Okay, if I find this, you can ask one more question.
Yeah, first
Yes,
is
okay. So that, as you know, that our previous speakers already mentioned there's more than 100,000 research papers show the health and well-being benefit of Tai Chi Gong. Of course, I'm more focused on the cancer patient. There's more than 500 Tai Chi Gong studies was published Tai Chi Gong studies. So we know that there's abundant evidence, as mentioned. But also then, sometimes when the study, a lot of people, they do not specify. So when I'm working the cancer patient, we see once you diagnosed as a cancer, what happens? Suddenly, anxiety. Wow, people alone. You get very stressful, anxious. And then, this is more psychological symptoms. So that Tai Chi Gong, not only for cancer patients or other community, a lot of other studies show that Tai Chi Gong for anxiety, depression, for psychological symptoms. So you can diagnosed, but even though not only for cancer patient, other cancer patient as well. And then after surgery, the people have a lot of pain and also joint pain, stiffness, and also depends on what symptoms they have. And then later when you go chemotherapy, a lot of nausea, vomiting, and as well as pain, difficult sleep. And then also chemotherapy, they causing some neuropathic symptoms. And then also all these symptoms during the treatment, the treatment is very gentle exercise. A lot of people, they recommend exercise. I'm sure physiotherapy said, yeah, we get the answer. No, patient says, I'm very tired, fatigued, difficult sleep, nauseous, vomiting. How they get to exercise in the gym? So for the patient, they are for different reasons. I told them, Tai Chi Qi Gong is one of the best one. You can modify, you can start breathing exercise, you can do meditation first, Qi Gong meditation, and this kind of gentle movement. If you're getting better, you can do standing, and then later more active. And also, again, not only chemotherapies, also radiotherapies, they have a lot of fatigue, sleep. And then when they go to, later they go hormone therapies, so a lot of people have hot flush, menopausal symptoms, because they're joint pain again. Also, all arthritis, joint pain, stiffness, many studies show that they can improve, yes, all the cancer patients. That's why cancer patient from the beginning to ending, during the treatments, you can apply. When you finish the treatments, a lot of people, they can post-surgical, after treatment, some people lucky, they cure, and also they can go back to normal activity. Some people metastatic, they're suffering the pain. Also, a lot of study Tai Chi. So sometimes even though after medication can control all the pain in the later stage. Maybe around 30%, 70%, 80% they can cover. But a lot of people, more than 50% people suffer the pain. Tai Chi depends on how we modify. We are not asking for an active standing Qi Gong for the people. Like the patients may have studied later stage. We have to teach very gentle Qi Gong meditation. And then the job we ask them to personalize medicine approach so that we modify Tai Chi Qi individual patient depending on their medical conditions. So also another issue is when we are making the certification programs in US. A lot of this Tai Chi Qi is we ask them, the patients have a lung cancer patients, a later stage, have difficult coughing and very tired, difficult sleep, many joint pain. Can you look after this patient? Can you do this? A lot of Tai Chi Qi they are not comfortable, they are not sure how to handle these patients. So we're going to train them like physiotherapists. This is the patient case. We can show them basic individual condition, how we can make it better. So once the patient gets better, 2 weeks later, or a month later, they can go group therapy, they can go group sessions. So initially we want to ask them to do personalized program. So that's the way we can introduce in health systems.
So you cover the most of the things of benefits and also how to integrate Tai Chi into healthcare system. Thank you so much.
Thank you.
From this week, and we go to young people. So, you work with, I know, as a therapist, you work with numerous patients with diabetes, stroke, heart disease, and what are the main challenges of these patients to use exercise for their rehabilitation?
All right, thanks for the question. So firstly, to introduce myself a little bit, my name is Jennifer Liu, and I'm a physiotherapist. So since I graduated, I participated in rehab hospital for neurological conditions rehabilitation. And then I also work in the musculoskeletal private practice, mainly treating on acute and chronic pain. I also work as a community physiotherapist, mainly treating NDIS and rehab package. So I am glad to try different multiple settings that I can treat and meet various conditions in the past few years. And very honored to be invited to this conference to share my insights and learning from the other professionals as well. So to answer the questions that I think the physical limitation is one of the biggest challenges that we introduce exercises and even Tai Chi to those conditions. Because many patients experience fatigue, very significant signs and symptoms in most of the conditions. Muscle weakness, feeling of tingling and numbness of their lower legs and feet, where it affects the balance most of the time and proper nutrition. So introducing exercise for those conditions is a bit challenging for us, as they might increase the anxiety and fear of performing the exercises. So some of the patients might think that exercise or even a bit higher intensity physical activities might exacerbate the signs and symptoms of their conditions. So there's involved a lot of insurance, education, and specific prescribed exercise program for the individuals, where it can be best fits their daily routine life. Short breath is another very significant challenging to introduce exercise as well, as many patients will feel a bit dizziness and fatigue, and that kind of increase the fear of falling and fear of injury to when we are participating in the exercises. Also understanding the exercise benefits, where most of the populations, they haven't heard or lack of knowledge about the standardized and recommendation of or any of guidelines of physical activities or exercises. So they might need a bit more introductions about what type of exercises in terms of aerobic, resistance training, or even Tai Chi or Qi Gong. So as long as they understand the benefits and understand the type of exercises which target their specific conditions, I feel like they'll be more willing to trial. And again, in terms of frequency, intensity, and duration, some of the patients might find it difficult to find the specific intensity and duration in their daily life. So during my practice, I will just clarify a bit more to the individuals for their exercises, so they have the guidelines and confidence and understanding about the exercise they're doing. So that's therefore to motivate themselves a bit more. And assess the resources. So I find it a bit to assess to find a suitable facility or programs to allow me to introduce those clients when I'm practicing in the private clinic. Interestingly, I did realize there's a lot of clients that come into a clinic that they're really happy to participate in a Tai Chi program. So I guess after this conference, I'll be more confident to introduce them to a certain program, to the institute, to the referral that they can look in for. So that's a lot of challenges, and that's as mentioned previously by the other professionals. So I think one of the best methods that I learned today is to introduce and educate a bit more to my clients about the benefits and evidence basis as well. So they're more willing to trial in the exercises and Tai Chi.
Thank you for sharing. Very James? No.
Thank you.
Yeah, James says we know you have very experienced Tai Chi master, and so we want to know, especially you as example for prevention, and we have seen lots of research there already. So what do you think of the unique one character that Tai Chi is different from all the other exercise, which brings benefit for prevention?
Okay. Thanks, Henry. Yeah. First, my background is traditional Tai Chi practice, so I'm specialized in traditional method. So the reason I say, or I define traditional is we follow the guidelines and principle passed on to us a couple hundred years ago, 100 years ago. Yeah? So in a simplest term, Tai Chi is called as Tai Chi because it's got yin and yang. Yeah? When yin and yang together, we have balance. So that's in a very simplistic term. But then come to, Tai Chi's exercise or training specific to balance and fall prevention, these areas. So first we talk about stand alone by yourself. Yeah? So you deal with static situation, you deal with moving situation. Yeah? So we have training method. When you steady, is using structure to deal with gravity. Yeah? So you can achieve song your body. When you song, then you can react. Further on, you can react to something unknown. Yeah? So that's one. Then in the moving situation, we have Tai Chi walk. Yeah? In a way, they say the Tai Chi catwalk, but it's different to the model catwalk. Yeah? So a typical principle in there is differentiate substantial and insubstantial. Yeah? So you don't let gravity take control. You have the control when you're stepping, when you're moving. Yeah? So that sets up the standalone situation. Then you're going to deal with unknown. Yeah? So that's where in Tai Chi we develop sensing skills. Yeah? And we develop the principle of follow the force rather than fight the force. And the training method is actually through pushing, because that's where you're dealing with unknown. When you're on yourself, you might be on top of the world. You're doing the best form you can. But as soon as you're dealing with unknown, bad habit comes in. So that's the training system we do. I think hopefully helping the fall prevention and improve the balance. Okay?
Thank you. Later.
Yeah, I'll share some exercise we do later on with you.
Yeah, thank you. And then next one, I think I want to ask a question from Moy. Dr. Moy Ahmad is a health economist. And because now there are very, very few research on Tai Chi research relevant to health economics. But I know it's very important. From your point of view, could you share why this research is important, especially if we want to incorporate Tai Chi into the healthcare system?
Thank you for your question. So let me give me a bit of background what I do. So I'm an economist by training, and my interest is in health economics. So as you know, economics is important, and I have been introduced to Tai Chi research by Emily when I have been to assess a economic-based intervention program which has Tai Chi ingredients compared to treatment as usual. So why health economics is important is that we have a lot of research that Tai Chi is beneficial, but it costs money, and there are cost savings associated with that. So from the economics point of view, it is important to know, this intervention of Tai Chi intervention has been implemented. Is it cost effective? Because you may have two different options. Now if you think from a broader perspective, you are not the only one who are worried about your health. The policymakers and the other stakeholders are also involved with it. So suppose that in a system in Australia where the healthcare system is mostly publicly funded, if you become unwell, then the health system has to incur the cost in terms of hospital visits, emergency department visits, medications, primary care, and etc. So it's important from a health economics perspective to know that if it is a cost effective or not. Give me an example so that's clear. So as you know, for maybe a chronic kidney disease treatment, two options can be kidney transplant or dialysis. So as you know that the transplant is more costly, but it gives more benefit. But at the same time, dialysis is Tai Chi, we know this is important and it's less costly, but we still, from the health economics perspective, we need to know that it is cost effective compared to some other interventions which actually benefits our health, like for chronic disease management. So from health economic perspective, it's also important to know that what are the cost savings associated with Tai Chi. Okay, so that can be like, okay, Tai Chi can be come as a preventive measures for conditions like fall. So fall is expensive, so if you can reduce fall by a certain percentage, then it means that you are reducing the hospital visit and the related treatment. Okay? And another thing is that the quality of life. You may also wonder about that, okay, as a health economist, we only are after the cost, but the quality of life is a very important measure for our health economics perspective. So we also need to know that what are the associated quality of life associated with the Tai Chi. Then we can compare with different across different interventions or in different settings, like that it can be in the rehabilitation care. Now let's take a step in a bit of broader perspective, like from the healthcare perspective. So we need to know from a health perspective, like, okay, it is beneficial for your health in shorter term, and it is reducing your visits to GP or hospital or emergency short term. We also may be very interested in the longer term goals. Suppose with a Tai Chi exercise, if you reduce your probability of having osteoarthritis or some cardiovascular problem, it means that you are actually reducing your visits to hospitals, medication, emergency, and these are the cost savings. So the health economic perspective is also important for us to know that what are those related benefits, and these are some of the areas that we need to explore. And yes, that's I could think of, and there can be even more.
Thank you very much. Very interesting. So I want to give you this. Yeah, you can put this back. Thank you. As the president of the as the president of the Australian TCAA Association, I'd like to know your opinion about how Tai Chi can help promote TCM practitioners to enhance their treatment outcomes and rehabilitation for their patients.
Because more patients have problems in shoulders or knees pain. But after treatment, they feel much better, but the shoulders still have limited range of motion. But I think use the Tai Chi. Your Tai Chi can strengthen muscle, your muscle shoulder, and the joint more smooth. Yeah? But I think we are after finish if still all can movement or it's good or much better, but not 100%. But we are weakness to is the Tai Chi or practice Tai Chi after range of motion for getting better. I think Tai Chi and the Qi Gong very helpful compare TCM treatment, maybe more benefits and more quickly recover. And because acupuncture, the more expensive. But if you compare Tai Chi, you can practice yourself. You maybe quickly recover. You don't cost too much money. I think that this is an opening to my own. Okay? Thank you very much.
Thank you. If we continue the discussion, the 3 days is not enough. We run a bit late, but we still offer opportunity. Everyone has some questions to our panel.
Anyone in the room?
I'll go.
question about the natural review.
You answer first.
No, thank you for your question. So, in a lot of the studies, Tai Chi has been found as cost effective, but then it comes to the decisions maker whether they will accept it based on the light of, in the light of the evidence we have. So did you ask your question on the basis of the private sector or the public sector?
Private.
Private sector. Okay, so for the private sector, I mean, I do see benefits associated because as a preventive measure, so like as a private sector, if a person becomes unwell, then they have to pay for that cost, right? And I have seen even some private sectors, private sectors, it means that insurance companies, that they actually promote some exercises, and if you achieve some, that milestone, you are rewarded. That can be one of the things that a private sector, so like private sector pairs specific, that can be done to promote it. So that, because it's a win-win situation for both the pair and the pays, in a sense, because if the person remains well, that's a health benefit for them. And from the insurance perspective, they actually have the probability of paying for the hospital cost or any medication or the related cost is lower. That's some of the incentive that the private sector may consider. And on the other hand, the public sector is that they still need to decide that, because always the budget is limited, and we need a lot of evidence based on if it is a cost-benefit ratio compared to the other things, to decide on whether to introduce in the public system. And I think the Tai Chi has this potential to be introduced in public sector as well, based on its cost effectiveness evidence around the world, although not that much in Australia. Some more research can be done to promote and to have the policymakers' attention. Thank you.
So can I answer any more? Yeah, so in addition for including for the covering by health insurance, there's two things. I was working actually the Australian government Department of Health was conducting for natural therapies for review. So it was initially around many years ago it was covering, and then 2 years, around 5 or 6 years it was reduced, most of them. And then now a lot of people complain, so they're reviewing again. But still the evidence is, they're looking for two things. They have a strong evidence, scientific evidence on human health point of view. But the only thing is that when we are conducting literature review, a lot of other people who is related with this other energy MRC people who was not expert on the Tai Chi Qi Gong, they are reviewing the Tai Chi Qi Gong literature review. This is one thing. And second thing is, of course, when you do the research, when generating strong evidence, scientific evidence, they will call them double-blind randomized clinical trial. That means we have to do two design. One group of people have a real Tai Chi. One group of people, placebo Tai Chi. But how can we create a placebo Tai Chi? This is one of the issues. But when you're looking at other people, when you do drug trial, they can make a real drug and placebo drug. And people taking the drug, they do not know. Also doctors, they do not know which one is real, which one first. Placebo. But in the lifestyle intervention, it's not possible to create placebo intervention with the Tai Chi. And then also the people receiving the Tai Chi, they cannot, most of the people, they know this is Tai Chi. This is another, the research point of view, there's other issues. So they still, they say, research for a lot of evidence is not strong. Moderate, mild to moderate, not strong yet. So still sometimes the recommendation is if you have a strong evidence with a briefing to cover, they're going to make a recommendation to minister to covered in this, and then all the insurance will cover the Tai Chi and most other therapies. But still, there's a lot of research methodological issues. And so now in America, they call them new methodological and practical research methods. So, but in Australia, maybe it could take some time to introduce practical research methods to introduce as a judge. Is a strong evidence or not strong evidence?
One more on Peter, and then maybe two from Zoom, please.
I come from a health background, and I can appreciate knowing the scale and the resources that are getting more and more limited by the greater and greater demand and the longevity of humans. I'm going to ask my question from youth. Our youth is very absorbed with technology, so they're not as physically active. There's a lot of mental health problems in our health youth area, and I was just wondering, has anyone, and I know there's not a lot of Tai Chi teachers out there at the moment, but has anyone looked at introducing Tai Chi into schools? I know a previous teacher was teaching some Tai Chi to her students, but introducing them to Tai Chi would help them in many ways, like their emotional and mental stability, their activity levels. We have a problem with obesity in young children, so they're moving, so they're using more energy, and I think it's a great investment. I was at a conference yesterday with bowls, and I suggested that this was bowling was a great activity because it's something you can start very young, move and take into late in life, and it provides you with movement and balance and socialisation, which Tai Chi can do all those same things. But you need to get in at grassroots. So has anyone bothered to look at the youth and the benefits of Tai Chi and approaching the government to introduce this to school curriculum? Anyone?
I think about someone in Australia, I haven't heard yet, but because in US, some people, they already introducing in the primary school and high school. So few people, they are publishing and their story and research paper. So it will be slowly they're expanding. And also the other ones, they usually Tai Chi is people, young people, they like more active exercise. And also a lot of Tai Chi, most of teachers, school teachers, they are not familiar with the Tai Chi yet. So there's two things. So first we have to do more research and expanding and make more story. And the second part is we have to do Tai Chi Qigong to teach to the teachers. So, unless they have to go then Tai Chi Qigong instructor to hire them for school, they have a limited funding. They don't have something to hire Tai Chi Qigong instructor to teach. So that's one thing. So also during the COVID last few years, I was teaching also Tai Chi Qigong for the patients, and she was the primary school teacher. The second half of the primary school in North Shore, she taught them, and then she taught this kid, and the parents were surprised. What you are doing at school? And then we got a good story from the kid, and the parents talked to the kid, and the parents and talked to the principal, so she got a promotion. So some teachers learn additional skill. That's the one way. So then we have to either teach the school teachers, and therefore we have to make more story, and then so then the Department of Education can look at some funding to introduce Tai Chi Qigong teacher to teach to the students. But it will take some time, but it start already at the beginning.
higher, like a more bigger viewpoint of view. Possibly involve kids in wushu, karate, and then once they're in, with the traditional philosophy behind it, it's a pathway to Tai Chi or other internal arts later, yeah? Because we look at objectively helping those kids, so which martial arts they do, possibly not most important, as long as we can help them. Yeah, that's my
I just
point.
think the health benefits, you're putting it on them and they're not really thinking about it, but they become more content within themselves and they're more active, and we'd have less demand on the health system, because mental health is a big problem at the moment and it takes a lot of money up and a lot of time.
Okay, so we've got one question from our Zoom participants. So it's addressed to Dr. Ahmed. Okay, it's a health economics question. I'll just read out slowly. An advantage of Tai Chi for older adults is that it offers a choice other than aerobic, resistance training, etc., to keep exercising for falls prevention rather than stopping. Is this choice included in assessing health economics?
Thank you for your question. Yes, so when we do the health economic assessment, so and if it is our intervention is Tai Chi related intervention, we can do this assessment in regards to what is the usual thing in the society or our use of the intervention. So yes, sometimes these physical activities can be used as a weight thing. So weight is control.
Actually, what happened?
Sorry about that, keep going.
Okay.
Sorry.
So in health economics, we call it the intervention and the comparator. The comparator can be the what is happening usual, or some other comparators like this physical activities or physical exercise. So this actually takes into account as a comparator in the studies. I hope it does.
Okay, thank you. I hope it does address to the questioner expectation. Okay, we're running about 10 minutes behind. Time for break? Yeah? Okay, time for break, 10 to 15 minutes break. So there's tea, there's water outside. And please, where would they join afterwards?
I'd like to invite everyone to join me group from
Thank you. I'll overlook that.
Yeah, and so we have tea outside. Feel free to grab some tea or water, or have some English tea, Chinese tea, and the bathroom just next to this venue. And after this, we'll go to ground floor. Just opposite to the elevator, there's a big conference room, which we will do some Qi Gong and Tai Chi for prevention there. Yeah, so yeah, feel free to enjoy yourself and have some rest. Thank you. Thank you.
So after 10 minutes break, or 15 minutes, we'll start the Qi Gong and Tai Chi practice on the ground. You should be able to see a bit more there.